A good morning, our student nurses and midwives. You are most welcome to this session. With you is Esther Inyongat, clinical instructor, Masaka School of Comprehensive Nursing. And today we are going to talk about taking weight and height of patients. So you are most welcome to our screening area. As you see in our area, we are having variety of weighing scales and then also the height scale. So this is used for taking height and it's known as a stadiometer. So this stadiometer can take height of children up to 12 years. And if a child is below 2 years old, it can be used to take length. So meaning our stadiometer can be put down and you use it for taking length. This is a sliding board that helps you to slide through this stadiometer. So that as you are taking length of the child lies down perpendicularly and then you can take off the length. We can learn it more practically. But it can take length of a child who cannot stand or a child below 2 years old. So this is our stadiometer. Or if you are taking height of a child below 12 years, it can also move. This sliding board can move and take off height. You can easily read off as you see these arrows. So if a child's height is this, you can easily read it off. So this is a stadiometer. It can take both length and height of children. And then the rest of the scales can be used for taking weight of patients. This is an adult scale and it's a manual scale that we use for taking weight of patients. And on this, it also has a measuring board, a measuring rod for taking height. As you see, it is movable, can be used also for taking height, meaning this is 2-in-1. You can take the weight of the patients who are able to stand, and it can take weight up to 160 kilograms for such a patient. At the same time, you can use it for taking height of an adult patient who can stand. And then we have an electronic weighing scale, still for adults. This can take weight up to 150 kilograms, still for a patient who is able to stand. And electronic, we mean it uses batteries. As you see, these are the batteries. You can just keep changing. And a patient who is able to stand can stand on it. And then on this is also a weighing scale for babies. And this is a manual weighing scale for babies with a baby pant. As you see, babies are put in here. But for babies who are at least 3 months and above, who are able to sit. And this scale, as you see, you can easily remove it. We have just used the drip stand just for visibility. But in practice, you can hang this on any strong rod and a baby can easily suspend on it without falling. So this can take weight of the children, but for children who are able to sit or 3 months and above, and they can easily hang freely here. And then we also have a weighing scale, still for babies, but this is an electronic type. And this is for children who are 0 up to 3 3 months old for babies who were less than 20 kilograms. You can put them here, and this is also an electronic one. As you see, batteries. These batteries can be changed. And you can easily take off weight of children less than 3 months old. We also have this spring weighing scale. It is for neonates. These are children up to 5 kilograms. So for newborns, we majorly use this during domiciliary when you are monitoring our mothers and babies at home. So you can easily move with this portable weighing scale and you easily monitor the weight of the neonate. On our table, this is our screening table where all patients come, and when they come here, this is where we take their weight and height before they seek any other medical service. So thank you so much. So be ready for our next session. We are going to look at taking of weight and height practically. Thank you so much. So you're most welcome to our practical session. Yes. Welcome to Masaka Regional Referral Hospital. And this is our screening area. This is where patients start from. So at this point, you are going to take weight and your height. And this will guide us in your treatment. Is this okay with you?
It is okay, nice.
Alright, I'm going to ask you a few questions. I request you cooperate. So may I know your name, please?
I'm Zoe Deha.
How old are you?
I'm 32 years.
Where do you come from?
I come from Masaka town.
Which religion are you?
I'm Muslim.
So, Madam Zawadi Hawa, as I told you earlier on, that in this screening area we are going to take your weight. So taking your weight will help us as we manage you, and also the treatment we shall give you. So I'm going to request you, are you able to stand and walk? Okay. So I'm also going to request you, we put the bag and phone here. Then you can also remove your jacket. Yes, because those are too heavy and they can add on the weight. In your bladder?
No, I'm fine.
Okay. So, since you say you're able to walk, so we are going to use this. This is what we call a weighing scale. It is used to take weight of the patient. So, before we take off any weight of the patient, you must make sure that the weighing scale is calibrated 0. Whether we are going to use this electronic or the manual, you must make sure that it is calibrated 0. So, Madam Hawa, I'm requesting you to remove your shoes. You can extend this way. You are comfortable standing there?
It is okay. So I stand here?
Yes, you stand. You put one leg this side and another leg that side. Please put your hands along your body and you look forward. Don't bend. It is 59.6. So you can get off the weighing scale.
Okay.
And put on your shoes. So I've taken note of her weight. It is 59.6 kilograms. So Madam Hawa, I'm sorry for disturbing you, but for purposes of learning, we are going to use the other second weighing scale.
Okay, please.
Record this safely. So we are going to use this weighing scale, the manual one. This was electronic. So still, we must make sure that our machine is at 0 or our weighing scale is at 0. So you're still going to do the same. You're going to remove your shoes, stand, put hands on your body, then you look forward. You do not bend. So the weight is 59.6 kilograms. So I request you to move out and you can go back to your seat. Thank you so much for your cooperation. So you are now free to put on your jacket and hold your bag and the phone. So your weight is 59.6 kilograms and it's not bad. Yes, there are no risks of any medical complications, maybe pressure, if you hear pressure. Yes, we call it hypertension. So thank you so much for your cooperation.
Thank you for the good service.
Alright, so this is your phone. You are going to go to the next door for other services. You see that we look at what is going on.
Thank you so much.
Alright, thank you for coming.
Mhm.
So our dear student nurses and midwives, you are most welcome to our second session, and at this time we are going to take height of the patient. So together with us is still Madam Zawede Hawa. So Madam Zawede, you are most welcome.
Thank you, sir.
Thank you so much for being with us in this session once again, and this time round we are going to take heights. Yes, we want to see how tall you are.
Okay, sir.
Okay, so I'm going to request you to come. So this is our instrument that we use for taking height, and as I told you, this weighing scale is 2-in-1. It has the part for the weighing scale, and it also has this measuring pole or the stadiometer that we use for taking height of the patient. So this time around we are going to use it for taking height of the patient. So Madam Hawa, this time around you are facing away from the weighing scale, and I request you to remove your shoes.
So you stand here?
Yes, stand, face away. You can move slightly back because I need your shoulders, your buttocks, and your heels. Yes, to be straight on the board. Then your hands should be on the body. Then you look forward. Slightly raise your chin. Yes, forward. So we move this measuring pole slightly above, and then you move it down slightly until when it meets the head perpendicular at an angle of 90. Then at this point we can read off our height. So this measuring pole or the stadiometer is calibrated both in inches and in centimeters, and we take off our measurements from down. So the height is 157 centimeters. So Madam Hawa, you can slightly kindly move down. Then you can take your shoes. Yes, so you put back the stadiometer back in its position. So Madam Hawa, your height is 157 centimeters. So this is a normal height.
Is it a normal height?
Yes, this is the normal height.
I was scared.
No, you shouldn't get scared. It is a normal height. And now you can still move to the next door to see the clinician. Thank you so much for your maximum cooperation.
You're welcome, please.